mind, Finding Common Ground with Doctors. He also serves as a seminar presenter for ACHU. We're pleased to have them present Of Lions and Lambs, Transforming Physician-Nurse Communication. And please join me in welcoming Kathleen Bartholomew and Dr. Joseph Bujeck.
Dr. Bujeck?
Yes?
I'm sorry to wake you up. I know it's 2 in the morning. Sorry to bother you, but that creatinine level, critical lab value of 3.8, I've just noticed in the chart for Mrs. Helens, and I wanted to make sure that you're aware of that. Doctor?
Tell me something, please. What was her admitting diagnosis?
Renal failure.
Renal failure. What is the creatinine value in a patient with renal failure?
Doctor, I know what it is. It's just that there is no record.
What was it on admission? Wasn't it 5.2? Is 3.8 better or worse than 5.2? In fact, is the patient getting better or is the patient getting worse? This patient has been in the hospital for 4 days with a diagnosis of renal failure. Do you realize what time it is?
Thank you, Doctor.
Do you know what time it is?
Yes, Doctor. I'll just make a note that you're aware of the value.
Yeah, right. And you know that this is the 4th time I've been called for the same critical value on the same patient with renal failure? What is the matter with you? Do you know anything? Where did you get your degree? In a Cracker Jack box? You 2-year graduates just don't know anything. Honestly, if I gave you a brain, it would be lonely. Before you call me again, I'd like you to please understand what goes on in clinical medicine, get your facts straight, and be certain that it's justified before you give me a call. Now that's it. Goodbye.
I came on shift at 11 o'clock. Yes, I know everything about renal failure. I'm an experienced nurse. But the first thing I do is check my 7 patients to make sure all of them are all right, take their vital signs. Then I go through 7 charts, and yes, that did take 3 hours before the vital signs and the medications were given. There is no record in the chart anywhere that this lab value he was notified of the lab value. So what am I supposed to do? Just 2 weeks ago, there was a critical lab value just above at 4.6 for the potassium, and I didn't call it in, and I got screamed at for that one. I'm damned if I do, and I'm damned if I don't.
Honestly, I just don't know what's going on in medicine. You can't trust anybody. I have to do everything. I don't know how many times I have to try and communicate, but it's never the same nurse. I don't even know who this bozo was that called me. Maybe I should have been a little more kind, but how much can one person take? It's 2 in the morning. I just get to bed. She calls me with something that's insane, absolutely unnecessary. And if she had half a brain, she would do it. Honestly, I think they're just agents of the Joint Commission. There is no thinking behind what they do. They just call because they react. They ask me if I would just teach instead of just become angry. But how many times can I try to teach when people just can't learn? Honestly, it's incredibly frustrating, but I would give anything for a good nurse. Too bad we can't recruit any at our hospital.
I don't know, Rosie. I mean, come on. You're good at deciphering his handwriting. What do you think it says? It's progesterone, don't you think? Don't you think it looks like progesterone? What do you mean, why don't I just call him? You don't know how he blew me off last week. I'm not going to call him, be treated like that again. It's got to be progesterone. It looks like progesterone, and it's stat.
Where's Mrs. Jones? Where's my patient, Mrs. Jones? What? She's in the ICU? What happened? She went into respiratory failure last night? She's intubated? She's on a ventilator? What's going on here? Progesterone? Who the hell gave her progesterone? Why didn't they give her the prednisone that I ordered? It's clear as mud here. People in acute asthmatic bronchitis, they require prednisone. This lady is actually in the the ICU because of the incompetency. Why in the heck didn't they call me? If it wasn't clear what it was, all they had to do was call me and I would have let them know that it is prednisone, not progesterone. You got to be a Neanderthal to imagine that we were going to give progesterone to this lady. What is going on here? I'm surrounded by incompetence.
You got to be Neanderthal to think that you put up with the abuse week after week after week. But I'm getting pretty good, I think, at reading handwriting. You know, I'm just a part of the woodwork. He doesn't even know my name. I worked there for 4 years. 4 years, full time, and I'm still nameless. Just the nurse. Just the nurse. I'm a part of the woodwork until administration wants me to make sure that the doctor's handwriting is legitimate, or do telephone order readbacks, or have their special abbreviation list. Then all of a sudden, I come out of the woodwork and I get to be a Nazi. It just wasn't what I thought it was going to be like.
Date, time, and sign? Whose insanity is this? Every single day I am just hounded with this date, time, and sign. What for? For an order that was transcribed and administered 24 hours earlier. My God, what good does it do? All we are just servants of the regulatory environment. Wish the nurses would just leave me alone. Do they think that I'm some kind of an idiot? Maybe when we get more male nurses, times will change.